Hi, my name is Danielle Allen. I am in the Doctorate in Athletic Training program at Indiana State University. I am an athletic trainer at LaPorte High School in LaPorte, Indiana. And this is my version of a comprehensive lower extremity evaluation. So how do I evaluate the entire kinetic chain, you ask? Well, for starters, I can honestly say that I am not doing this the majority of the time. But when I do, the evaluation is thorough and detailed. Generally, my evaluations are in the heat of the sport events that need to be addressed as quickly as possible in order to make a return to play decision. But when I do get an athlete to come in during treatment hours, I am able to evaluate his kinetic chain slightly more. Usually, I ask about previous injuries to the current pain location, then travel away from the area and ask about other injuries. Here is a more specified algorithm for how I approach lower extremity evaluation. I first begin with asking the athlete his pain level. I determine if there is a previous injury to the affected extremity. Is it chronic or acute? I then find if there is a previous injury to the distal or proximal joints. Was the mechanism of this injury from a contact hit or a non-contact? Is there visible bruising, swelling, or a deformity? I then evaluate for tissue damage or bony pathology. Once I rule out a fracture, I then evaluate the ligaments. I then perform ligament special tests, medial muscle tests, and joint range of motion. These are all performed bilaterally. I then ask the athlete to weight bear. Are they able to walk? Are they able to run? And then I perform sport-specific movements. I usually follow with the balance test, then check their lunging ability and their body weight squat ability. The lunge and the squat give me an idea of strength and flexibility, while the balance test indicates their core strength and in some cases their athleticism. With all of this information, I then make a return to play decision. So what am I missing? After self-reflection and a literature review, I've concluded I need to practice more time and patience with my evaluations, a more hands-on approach, a more detailed, comprehensive medical history. I also need to record specific measurements, including Q angle and leg length discrepancies in the athlete. Foot type is also important. Excessive supination and pronation can lead the athlete to a susceptible knee pain. These articles are a reminder of the importance a thorough exam makes on a patient's overall care. In the future, I plan on noting foot type in my evaluations, as well as measuring Q angles and leg length discrepancies in my athletes. Implementing patient-reported outcomes and clinician-reported outcome measures are very important to evaluations, and I can honestly say I have been improving throughout the course of this semester, but it is a continual thing I need to work on and implement in each and every evaluation.
Created using Powtoon.